Necrosis is defined as an intravital, unprogrammed death of a cell or a tissue. Basically, cells or a tissue unintentionally die, while the organism is still alive. In the picture, you can see a group of necrotic hepatocytes with loss of nuclei and smudgy hypereosinophilic, meaning overly pink cytoplasm. Close to them, there is a cluster of vital hepatocytes with preserved nuclei. Necrosis represents a common phenomenon in various liver disorders. It can be classified according to its extent or its distribution within the liver lobule. Individual necrosis of single hepatocytes or necrosis of small groups of hepatocytes are nonspecific findings accompanying many liver diseases. They may also reflect diseases from other regions of gastrointestinal tract or systemic conditions such as sepsis. In the microscopical picture, we can appreciate a small group of necrotic hepatocytes surrounded by an inflammatory reaction, so-called necro-inflammatory change. In some instances, earlier stages of hepatocyte regression may be seen. Regression generally means a pathological phenomenon leading to a cell death or mild forms of cellular damage. Such hepatocytes that underwent mild form of regression are swollen due to defective osmotic regulation, leading to marked intracellular edema. This condition is called ballooning degeneration. It's a common finding in acute hepatitis. In case of larger, more extensive necrosis, a term confluent necrosis is used. It can be subclassified into zonal and bridging. Zonal necrosis affects one of the three zones of liver lobule. Centrilobular necroses are characterized by a necrosis of hepatocytes in the close proximity of central veins. They are typical for acute hepatitis, alcoholic steatohepatitis, or circulatory disorders such as Budd-Chiari syndrome or acute shock. Here we can see a liver with signs of severe chronic congestion. A central vein is dilated and the surrounding centrilobular zone of hepatocytes is necrotic. More peripheral parts of the hepatic lobule show dystrophic changes in the form of steatosis. It's a consequence of hypoxia in the terrain of chronic venostasis. Only the thin rim of periportal hepatocytes remains unaffected. Periportal necroses affect hepatocytes adjacent to portal tracts. They come in active chronic hepatitis or disorders of biliary tree. Here we have a piece of liver tissue obtained by a needle biopsy.
Ouch!
It's a preferred method by which liver specimens are taken. Therefore, we can appreciate only a thin cylinder of the tissue. In the picture, there is an intense chronic hepatitis. The portal tract is expanded by fibrosis and infiltrated by dense chronic inflammation. The inflammatory infiltrate extends into the liver lobule, so-called interface hepatitis, with necrosis of periportal hepatocytes. Midzonal necrosis manifesting in the zone 2 of the liver lobule are rarely observed. They can appear after exposure to some hepatotoxic drugs or in patients with yellow fever. In some cases, the necrotic zone may link with another necrotic zone from adjacent liver lobule. This phenomenon is called bridging necrosis. It's often a component of severe active hepatitis. Therefore, it's usually accompanied by inflammation. This picture may not seem like a liver at a first glance. It's again a needle biopsy specimen with signs of intense chronic hepatitis. We can appreciate chronic active inflammation affecting portal spaces and extending into a hepatic lobule. Eventually, The strands of the inflammation, together with a necrosis of respective hepatocytes, merge and form so-called bridges. The bridge of necrotic hepatocytes may connect two portal tracts and central vein, or two central veins. In case of severe liver damage, necrosis may become confluent, affecting multiple liver lobules. Based on the extent, we use terms submassive and massive liver necrosis. In the picture, we can see a massive necrosis of liver tissue. All components of the parenchyma are necrotic, and we can appreciate only shadowy remnants of the cells. Apoptosis is a form of programmed cell death. We can understand it as a cell suicide. Apoptosis is a common non-specific finding in many liver diseases. However, it's usually more prominent in acute hepatitis. Apoptosis can be seen as individual scattered, shrinked hepatocytes with densely eosinophilic cytoplasm and pycnotic nuclei. Pycnosis is a condensation of chromatin in a nucleus of a cell undergoing a regression. These apoptotic hepatocytes are often referred to as Concealment bodies. Regenerative ability of the liver is enormous. In case of mild liver damage, the parenchyma regenerates by mitotic replication of adjacent vital hepatocytes. More severe liver damage leads to activation of liver stem cells in canals of Herring. These cells can differentiate into both hepatocytes and cholangiocytes. Such reaction, called ductular reaction, is seen as a proliferation of irregular tubules resembling small biliary ducts, often without true lumen.